parents, Dr. Tony Ebel checking in here, and I'm a pediatric chiropractor, which means over the last 15 years of clinical practice, I have literally seen thousands of cases of torticollis and plagiocephaly. I want to walk you through 4 key things that all parents need to know. Now, if you already have a kiddo diagnosed with torticollis, plagiocephaly, that's probably why this video was a little bit more attractive to you and you're watching it, but also all parents, please watch this video. Please share it even with new parents, because the number one thing, getting right into it, that I want you to know about torticollis and plagiocephaly is it's often missed. See, most of the time, for most families still today, the primary and almost kind of only doctor checking in on their baby and on their infant in the early months and early years is the pediatrician. And a pediatrician is awesomely a trained generalist. They know a lot about a lot of things, but they don't necessarily have a deep understanding of what we call the neurospinal system. And the neurospinal system includes the neck, and it includes the skull and the cranial bones. And the key with torticollis and plagiocephaly is that even a little bit of it, even little interferences and imbalances and these misalignments, subluxations, these things we'll talk about here as we get going, even a little bit can be a big deal to the developing child, to the developing neurospinal structural system, to the developing nervous system, to the developing brain, so really to the developing child. And so because they're not trained as in-depth as, say, a pediatric chiropractor, PT would be to look at these things, so often they're missed for months, even years. The reason I was able to start this video by saying I've seen thousands of cases of torticollis and plagiocephaly is because they weren't all diagnosed with that by the pediatrician, because hundreds, maybe even thousands of them were missed by the pediatrician. So that's the first thing to know, is this is often missed. I guess you can't really even say misdiagnosed. It's just missed altogether. Second thing, we're going to jump to the other end of the chronological spectrum, if you will. We see plagiocephaly and torticollis challenges in the case histories of what we call perfect storm kiddos later on in life, all of the time. So kiddos with sensory challenges, ADHD challenges, anxiety and emotional dysregulation challenges, spectrum challenges. Very frequently, very commonly, when we dive into their early childhood and their infant case histories, they went through plagiocephaly and they went through torticollis sort of changes. And while it was dismissed as, do the helmet, do PT, and they'll grow out of these things, the truth is, and we talk about all the time on this platform, that they often, these neurostructural challenges, create a neurological system or neurological pathway, if you will, where kids don't grow out of the torticollis and plagiocephaly, they grow into other challenges that are still stuck and still stressing their nervous system out. And that's why step number 3, point number 3, is oftentimes the PT, the helmet, the kind of traditional therapies and things that go to treat plagiocephaly and torticollis don't get all the way down to the root cause. Now, here's the deal. Let me step sideways as we're moving forward through these 4 points. I have a child myself who medicine absolutely saved. I've seen the best of the medical system. I've seen the best of pediatric, PT, OT, speech therapy. We work hand in hand with holistic, integrated pediatricians, neurologists, PTs, OTs, speech therapists, ABA, everyone. We love every therapy, every treatment that can get a child results and get them moving forward. The difference is the work we do as pediatric chiropractors is obsessively, relentlessly focused at getting at the root cause. The way that the nervous system, the way that our child's health works is the nervous system, the central and autonomic nervous system sets the tone, which is the amount of tension or not on the muscles and ligaments, so the soft tissues. So you got neurological function, then soft tissues, muscles, ligaments, and then that moves bones. So 1, 2, 3. So plagiocephaly and torticollis on the outside looks like a bony and muscular problem. So most of the time the helmet and the PT focuses on the bony and the muscular problem. But when you really understand neuromuscular, neurophysiological function and get to the root cause, these children have a stressed out, wound up, tense nervous system. So even if you force them to stretch the muscles or you force the bones to move in a different direction, you're not getting to the true root cause of the nervous system. So that's point number 3. And point number 4 is exactly that. The root cause often comes from a very stressful pregnancy. Perhaps there was breech or abnormal positioning. And most importantly, the number one trigger, the number one correlation we see with plagiocephaly and torticollis, this won't surprise anyone. It's in the literature. You just see it happening. It's birth trauma. It's interventions such as forceps and vacuum and emergency C-sections and inductions. Anytime there is extra physical force, twisting, pulling on the baby's head, neck, and spine, which is, for this video, I need you to understand, when we say head, when we say neck, when we say spine, we mean brainstem. We mean central nervous system. We mean this thing called the vagus nerve, which is supposed to relax things. We mean this thing called the spinal accessory nerve, which controls these muscles, the SCM, which are very involved in torticollis and very involved in the positioning of the skull, of the neck, and keeping it in the middle, keeping it rounded out, keeping it moving. And that's what kids with torticollis and plagiocephaly can't do. They have misalignments, they have tension, they have asymmetry, abnormal tensions. All of that can be tracked back to this thing called subluxation. The number one trigger of subluxation is abnormal positioning in utero, and then birth intervention, injury, and trauma. So if you really want to get to the root cause of what's going on with your child's torticollis or plagiocephaly, or if you're wondering if your child has a little head tilt, they're not nursing as easily on one side as another. They're always sleeping and favoring one side. They get fussy and tense and stretch and arch when you turn their neck or their body to one side. They hate tummy time. They're developing a flat spot. Any of these signals, and by the way, we're going to link to the articles. We have 2 phenomenal articles on our website about torticollis and about plagiocephaly, and you can learn more about them there, including more signs and symptoms of these things. But the one thing, if you're seeing some of these signs or all of these signs, is keep digging. Keep getting to that root cause. Get into one of our practices. Get into a pediatric chiropractor in the pxdocs network, because we use a technology called the insight scans. And the insight scans look deeper. They do absolutely measure inflammation, muscle tension, but they do it by measuring neurological tension, neurological interference, and dysfunction first. And nerves move muscles, and muscles move bones. So if the nerves are stressed and subluxated, that is the deep, deep, deep root you've got to address, so that you get rid of the challenge altogether, so that the child can heal all the way through their torticollis and their plagiocephaly. And then back up to point number 2 about we see it too often in these case histories of neurosensory, neuroemotional challenges later on. By getting it all the way taken care of early, you can get that child not only better and through those challenges, but you can really hold off a lot of troubles and a lot of stress that may show up later on in life. So if you suspect your child has torticollis, plagiocephaly, or if you already have the diagnosis and you're trying PT, you're trying the helmet, or if your child's even older, if they're 3, 4, 5, 8, 10, and you still see them carrying stress, you still see their shoulders asymmetrical, just do a simple parent posture evaluation. And if there's head tilt, shoulders are off base, then that could still be these things lingering in their nervous system. And if it's still in their nervous system, it's still in their muscles and it's still in their structure, and we can find it and we can help. So reach out to the pxdocs network, go to the website, read the articles, check out the directory, learn more. We are always here for you. Anything you need, just comment below, ask questions, share your experiences going through. Maybe you had this with your kiddo and you went to a pediatric chiropractor. Like, share your experiences. If you need to find an experienced pediatric chiropractor, we're here for that as well. Send us a comment, send us a DM, go to the website, read the articles. We love you. We can't wait to help. This is a real issue that we got to get beyond the muscles and beyond the structure to the nervous system, and really help these kiddos out to get their nervous system and thus their entire life to their full potential. Love you. See you on the next one.